breakdown also. But which one will be more severe? Synthesis or breakdown? Hmm. But they are not.
Yes.
Okay. It means the person will suffer with the hyperglycemia, right? Okay, that's good. So that is a very nice presentation. Okay, you prepared very well. But let me tell you about the exam purpose. If this question come in your examination, okay, so you have given a very detailed slide. So for each slide, I mean for exam purpose, you have to give a short introduction. Then you have discussed different types of glycogen storage disease. So here you have to mention the name of enzyme and their cause. Okay, okay, and at last you have to talk about the symptom and their treatment if there is any treatment available. Okay, you have to finish. Okay, now here we are going to stop the presentation. Okay, I'm just sharing the link for the attendance. Okay, just fill that attendance, and Dr. Viral is waiting for your lecture. So after finishing here, you can join their lecture. Okay, just give attendance and you can leave the lecture. क्या नहीं हो रहा? एक मिनट No.
Yes, good morning to all. I hope everyone has joined. I'm putting attendance link. And while putting your attendance, put the enrollment number as a 0102 or something like that. Not a whole entire. Some people are putting the 31, 30 whole number. While submitting in your Google form, just put the 2 digits, last 2 digits, not all. And other problems, I don't know. Many of you, yes, not able to rename yourself. So those who are not able to attend or rename themselves, that means they are unknown for me, right? So I have removed those who were unknown to me, those who have able to write their proper naming. Yeah, so now remaining 24 participants only. So including me, that is one. So easily I can take the screenshot also, the entire screen. Yeah, so this many students are present. Those who are not able to rename themselves are learn from the others. Fine, so let's talk about some topics. So today's topic we are going to discuss that is a polycythemia vera. Okay, next part into our remaining topics is there. So it is the overproduction of WBC and RBC, kind of a you can say abnormality, or kind of a you can say the conditions in which the number of the cells here the you can say the myeloid cell myeloma proliferative neoplasm MPNs also termed a number of blood cancers that share several features. So what's going to happen in particular things? Uncontrolled RBC production. As the blood cells are going to increase in a number, there are the several reasons behind it. That is a maybe some mutations had taken place during their developmental stage, and which may result into a certain problems. Yes, sir. બધા name change કરી લીધા છે. Yes, I have removed for today, so they are not able to join in this meeting today. Already I have told last day, that they have to rename themselves. And those who are not able to rename, and those I have removed them. So today's meeting is not allowed. આજની meeting may join નહીં કરી શકે. So they can rest at their place. No issue. Whenever it is not been told that it is either removed or the not be told, you are not going to do a certain things. So what happened? That is in all productions. That is almost all patients with this polycythemia vera have the mutation of some particular gene called the JAK2. That is a genus kinase gene, which helping into early blood forming cells. That is the hematopoietic stem cells are there. When they have moved to the myeloid lineage to erythropoiesis, in a way they are looking to develop a you can say particular platelet like cells. Okay, so when there is a lineage has been started, some of the errors may have happened and which may lead to some affected cells formation. Okay, so what is that? That in this, what are the signs and symptoms? That the too many blood RBCs make the patient blood more viscous, so the blood does not flow efficiently. કેમ કે એટલા બધા સેલ વધી ગયા હશે in the you can say the blood vascular system is there, but the capillaries are full of the cell. It is like that full of the hematocrit cell volume. આપણે જો ચેક કરવા બેસીએ તો ટ્યુબમાં પણ એટલું બધું દેખાશે અને બોડીની અંદર એટલા બધા સેલ્સ વધી જશે which is limiting the blood flow even. And the high platelet count can contribute to the formation of clot or the thrombi. मतलब કે platelet is required for one particular targeted part કે જે આપણું blood clotting કરે. એટલા બધા cells platelets વધી જશે એના લીધે શું થશે? જરૂર વગરના clot formations પણ થવા મળશે. And the underlying the vascular disease common in older persons with the polycythemia vera can increase the risk of clotting complications. मतलब કે just નાની મોટી injuries થવાથી તો જે clotting થવાનું start થયું, but it then after not going to stop. આખા બોડીની પાર્ટ્સમાં બધે within the vessels also clotting may start to happen. અને એ બહુ મોટી એક પ્રોબ્લેમ થઈ જાય છે. And the clot may cause a serious problem like a stroke, heart attack, deep vein thrombosis or the pulmonary embolism. Okay.
सर वॉइस प्रॉपर नहीं आ रहा है.
Okay, maybe some have some network now. Can you hear me properly?
Yes,
आवाज
sir.
कब है सर?
Okay. Just 1 second. So can you hear me now properly? आवाज આવે છે?
Yes sir.
Okay. Maybe sometimes network issues are there. Let me continue for our presentation part. Okay, so here the sign and symptoms is very simple and easier. RBC ખૂબ જ વધી જશે. શું થશે? Blood will become more thick. So, flow માં પણ problem થશે. And the another is a platelets. Platelet counts પણ અત્યારે બહુ જ વધી ગયું છે. And which lead to clotting at the entire the body several place part. So like veins ની અંદર પણ clotting થશે. It's going to give the stroke or the heart attack. Body is trying to get the blood and heart is trying to pump the blood as much as possible, but within the vessels there is a clotting has taken place, which causes much problem. Then the deep vein thrombosis, that means veins ની અંદર ઘણી બધી જગ્યાએ શું કહેવાય clotting has been formed. Okay, and these issues may lead to certain problems into entire body part. Okay, just I have kept one small documentary into it related to the polycythemia vera, that is related to causes, symptom, diagnosis, what are the treatment and the pathology of which.
In Polycythemia vera, there are
Voice is coming for this clip?
Yes, sir.
Documentary? Okay, fine, let me continue then. It is maybe a 3 to 4 minutes long, not more than that.
increased blood cell levels due to overproduction by the bone marrow, which is a soft tissue found within the bones. Normally, about 45% of the total blood volume is made up of erythrocytes, or red blood cells, and their main function is to carry oxygen to tissues and bring carbon dioxide to the lungs so it can be expired. This value is called the hematocrit. In Polycythemia vera, there's an increase in red blood cell production. It typically begins with a mutation in a single hematopoietic stem cell, which gives rise to red blood cells, white blood cells, and platelets. In 90% of the affected individuals, there's a mutation of the Janus kinase 2 or JAK2 gene. Normally, the kidneys produce erythropoietin, which is a hormone that binds to receptors on the hematopoietic stem cells and activates the JAK2 gene. When that happens, it causes a cell to divide and thus produce more blood cells. However, when there's a mutation, it keeps JAK2 gene activated, and these cells are able to divide even in the absence of erythropoietin. The mutated cells proliferate and rapidly become the predominant hematopoietic stem cells in the bone marrow. In time, these cells start to die out, and that's when scar tissue forms. At that point, the bone marrow can no longer produce blood cells, leading to anemia or low red blood cell levels, thrombocytopenia or low platelet levels, and leukopenia or low white blood cell levels. This is known as a spent phase, and once the disease is in the spent phase, it's really a different disease altogether. At that point, it's myelofibrosis. The most common symptoms of Polycythemia vera are fatigue, dizziness, increased sweating, redness in the face, blurred vision, and itchy skin, especially after a hot shower. Itchiness develops due to an increased number of basophils and mast cells, which contain histamine that causes itching when released. Splenomegaly, or spleen enlargement, is also common because the excess red blood cells build up in the spleen, which usually helps with removing excess cells. High turnover of red blood cells can cause buildup of uric acid, which leads to the inflammation of joints or gout and kidney stones. Individuals with polycythemia vera are more prone to blood clots and their complications like stroke, heart attack, deep vein thrombosis, and Budd-Chiari syndrome, which is when the liver veins are blocked by a blood clot. Sometimes the disorder can be found during a routine blood test. Common findings include increased hemoglobin, or hematocrit levels, as well as an increased white blood cell and platelet count. Most individuals have decreased erythropoietin, but some individuals have normal or even elevated erythropoietin levels. Bone marrow tissue examination or biopsy can be done to look for signs of fibrosis, and genetic testing can be done to look for the JAK2 gene mutation. Most individuals require phlebotomy, which is when the blood is drawn through a vein and removed every few months. This blood isn't donated for other individuals, but can be used for autologous donation, so the donor can use it in the future if needed. Myelosuppressive medications, like hydroxyurea, as well as a JAK2 inhibitor, ruxolitinib, can be used to lower red blood cell formation. Ruxolitinib is also particularly helpful with relieving symptoms like itching. Other medications that can also help relieve symptoms include antihistamines, hydroxyzine, and aspirin. Aspirin is also used to help prevent clotting. In the spent phase, individuals may need blood transfusions at regular intervals. Alright, as a quick recap, polycythemia vera is an overproduction of blood cells, often caused by a JAK2 mutation within hematopoietic cells in the bone marrow. It can lead to an elevated hemoglobin and hematocrit and predispose an individual to developing blood clots. Treatment includes removing blood at regular intervals, medication to lower blood cell formation, and prevention of blood clots. Patients may progress to myelofibrosis, which represents a spent phase of the bone marrow, where individuals may need blood transfusions or more aggressive therapy.
Fine, so it is a very small documented part. Right? So regarding a you can say cythemia or the chythemia. Yeah, that means here the RBC production is going to rise a lot, as well as the platelets. In this part, they haven't more given attention to the problems and issues, but what we are looking that is also required, right? It is the symptoms we need to understand. This clotting is going to take place as various places, in which going to cause the like a heart attack or the deep vein thrombosis. That means clotting is taking place into various body part and within the veins. Okay, so how the diagnosis could be done? So it may be based on the genetic marker level. Also, we can go for the PCR based. Another is just the isolation of the blood part is taken, because these are the some factors will you can say produced by the kidney cells and going to reach to the bone marrow. So this related part also we can understood, and the estimations biochemically can done. Also some basic part, if it is the platelet counts we can go for, and the WBC, the neutrophil counts. If it is there, we have to check about the red cell mass or the you can say the hematocrit. Normal part it is there. If the person is found always the hematocrit level is higher, that is blood volume, that means we can understood that there is some issues are there in that person. And mutations we have to identify related to JAK2 genes, which only essentially possible using the PCR based techniques. Also, like a polycythemia within this, if it is in a secondary stage, then there is a chances of getting the all the blood counts very much reduced. On the first phase, it has increased, and the second phase it has decreased. So it is not a directly kind of a cancer. It is different from the cancer. Here it's someone error has came that continuous production is there. It is not uncontrolled growth. The cancer is totally different story. That is uncontrolled cell division is takes place. Here, the proliferating factor has increased, and which increment has lead to some effect on the body part, right? So it is somewhat different story than the, you can say, directly cancer carcinogenicity. Okay, and what are the treatments into it? Here we may try to lower the hematochromatic concentrations, that is a blood volume, normal or near to normal value is required. How we can do? We may use the low dosage of the aspirin. Aspirin is very well known in this regard. Lowering also platelet counts is required from time to time, and decreasing the PV related symptoms. Patients with a low risk PV are usually phlebotomized and given the low dose aspirin. Blood આપણે continuously monthly આપણે એનું લઈ check કરતું રહેવું પડશે, અને aspirin as a medicine part we need to give to them. And another medical therapy is required to decrease the blood clotting. Blood clotting factors જે આપણે ખ્યાલ છે, તો we require to reduce the blood clotting within the blood. Some medications is prescribed in a way that to decrease the hematocrit level as well as decrease the, you can see, the clotting. So either we can decrease the platelets, or as the effect of the platelets increment is what that we need to control the clotting. So આપણે શું કરી શકીએ કે clotting જે factors છે એને આપણે ગમે કરીને decrease કરીએ. Fine, so this one is a very small topic in this part. Okay, so if you have any questions, you can ask to me. You can unmute. I may have the chat box also open. Is it clear? બહુ સહેલું છે આમ જોઈએ તો, જેની અંદર કશું થતું નથી કે અમુક જીન્સ ની અંદર એડિશન્સ, sorry, there is a mutation is going to take place. Okay, and this mutations is lead to early જે blood forming cells છે એને uncontrol કરી નાખશે. Uncontrol કરવાથી a continuous productions કરી દેશે, right? So this effect has lead to blood cell RBC increment થવું, અને second platelets. RBC ખૂબ જ વધી જવાના લીધે શું થશે અહીંયા કે એની પાસેનું hematocrit volume વધી જશે and the clotting factors ખૂબ વધી જશે, so which lead to a stroke kind of a things or the heart attack issues વધી જશે. And what are the methods to diagnose? We may go for the PCR based or the biochemical based analysis. CBC and other count we can continuously to perform. And the low level of aspirin is been observed that can control this polycythemia vera. If you have any questions, you can put in the chat box, or if it is understood, you can write over here. And that is why I have shown the small documentary કે થોડુંક તમને સમજાઈ શકે. If anybody having any questions, they can put. If it is clear, you can also unmute or write down that it is clear, so we can move ahead accordingly. Yeah, so many of messages is clear. Very nice. Okay, so I'm sharing that again the our Google Sheet. So you can, those who are remain, એક ને એક જ જેને કદાચ તમારો ક્લાસ જોઈન કર્યો હોય ત્યારે અપલોડ કરી દીધી અટેન્ડન્સ, તો પાછું લખવાની જરૂર નથી. નો નીડ ટુ રિપીટ ધ થિંગ્સ. એની અંદર બે જ વસ્તુઓ ખાલી છે, તમારું નેમ એન્ડ એનરોલમેન્ટ નંબર. તો એનરોલમેન્ટ નંબરના લાસ્ટ 2 ડિજિટ જ તમારે જસ્ટ પુટ કરવાની જરૂર છે. ઓકે, Just last 2 digits is required to put and your name. So today I'm not going to continue for the next topic. You can also take rest. Those who have completed, put their attendance using the link, they can leave. No problem. If you are having any questions, you can stay.